What's happening, y'all? Tonight, I wanted to talk about another problem that we're starting to see in this never-ending situation with this COVID pandemic. That, excuse me, I don't think we've taken into consideration. Nobody's really been talking about the burnout factor on healthcare personnel and what we have to endure when working and trying to help people. But I wanted to try to, give some perspective on how it's affecting folks. And some of this information up here is a little dated, but I took down a couple of, a couple of, comments from nurses and from other stories that I found, looking to try to get different experiences from healthcare workers and ancillary staff. We don't really talk about the ancillary staff. The ancillary staff are the people who clean the floors, clean up, bloody, messes, other types of organic messes, that keep everything clean so that we can do our jobs. And a lot of those people are quitting as well. So if you don't have people to clean the floors, to cook, to do maintenance because of fear of either becoming infected or just the burden, the mental burden of having to see people suffer, endlessly, day in and day out, is a different kind of job. So I'll start out with this comment that Mary Lynn Briggs made, an ICU nurse in Bakersville, said all of the COVID patients she treated, only 3 are alive. Some days coming home from the hospital, I yell at God, I yell at myself, I yell at COVID and cry. And that's all before I pull into my driveway. So, when people are out here disparaging the situation that we're all in right now, I want, if I have some of these people listening, which I'm sure I do, I've addressed some of them in the comments, and I want you guys to kind of think about that. Think about the toll that it takes on healthcare workers and ancillary staff having to go into these places and to see people die and suffer every day. Numbers that just keep piling up. Over we're fast approaching the 2-year period where I think some of us have seen more people die in that short a time than I just really don't have anything else to compare it to other than a wartime situation. It's a heavy burden. I don't, it's hard to make someone understand how difficult it is to have to go into these places and to have to treat these people. And then I was on a panel a weekend before last, on the breakdown, woman's perspective. And there was an individual on there who was basically saying that this is the equivalent to the common cold. The the COVID virus is nothing but the common cold. He's saying that the common cold is a coronavirus also, and pretty much it's the same deal. He's pretty much calling it a hoax, and I heard all kinds of stuff on there, and it really it kind of got to me. It was very difficult for me to have to listen to that when I have to educate people and have to treat people and watch these people suffer the way I've had to over this period of time, and it still hasn't stopped. And the comments are just sheer ignorance. But I'll do a show on that, and I'll break that down a little bit more within the next couple of shows that I do. But we'll move on to the next one. Nurses are quitting because of the COVID-19 burnout, causing a mass shortage. I yell at God, I yell at myself, I yell at COVID and cry. Same comment that the lady said in the first comment. It says around California and the nation, nurses are trading in high pressure jobs for a career change, early retirement, or less demanding assignments, leading to staffing shortages in many hospitals. Hospitals now say they are reaching a crisis point, straining under the dual forces of more people seeking routine care and surging COVID-19 hospitalizations driven by the Delta variant. And that's everywhere. It's everywhere. We're seeing it everywhere. We're having to work with, half staff, sometimes no staff, having to double up. Nurses are working every day of the week because they can't take off because there's nobody else to work. And some of us are doing this out of the kindness of our heart, because, there's a limit to the time that you can work and be effective. That cuts off at like 16 hours. Now imagine a person working like that every day, and they struggle to try to give you 1 day off, let alone 2 days off, so that's what we're looking at now. Here's a story that was, about a week ago, we were talking about Florida, setting an all-time record in COVID-19 deaths in 1 week, reporting, 1,486 new additional deaths this week. Governor DeSantis, this is on you, was a comment that somebody was stating. And on the bottom, you'll see a chart here that shows those deaths over a time period, and how those deaths have fluctuated, rising, you see peaks and troughs in that, but those estimations go from, the same time last year to this year, and you'll see, where there were low points, and then getting up to this point this point in the year, in the same month, we're starting to see increases that are surpassing, almost doubling, if not doubling, the numbers that we saw last year. Yet we're still walking around. I don't think that's really hitting people that we were shut down with less numbers than what we have now. And now there is no shutdown, but people still aren't doing what they're supposed to be doing, even though we present the information. We're as forthcoming as we can possibly be about what's going on in these hospitals. People are having to increase the numbers of their ICU beds, somehow get the equipment to man these extra ICU beds, and then you're having to try to get, respiratory staff, ICU qualified nurses, physicians to take on even more critical care patients, when we already have a situation where we don't have enough doctors and we don't have enough nurses. And then the nurses that we have are telling people that there's no way that I'm going to go through what I went through last year, this year, in a worse situation, more patients, a deadlier version of this COVID that we saw from the last time. I can tell you that the last time I had 25 people. 25 people died within less than a 3-month period. And I stopped counting at 25. Okay. 25 people I was personally responsible for. So, when I hear people sit up and say these ignorant things, and I even have a family member that I have to sit up and fight, and try to, undo the damage that these conspiracy theorists and these politicians who are trying to manipulate people into supporting their cause based on some, far-fetched political ideology to make these people think that they're on their side. It's getting out of hand. It's getting to the point to where we have people out here proposing these, logical fallacies and illogical fallacies, and it just doesn't matter. You can present the information. You can show them that the premise that they're proposing is false, and they still continue to go down the road of, I just don't believe this is necessary. I'm not going to take the vaccine. Then when they're in the hospital, it's a whole different situation. You see a humbling that is just, it's mortifying. So we'll move on to my next section here. And I think I'm just going to go ahead and I'm going to talk about some of the comments that are in, just in my Twitter feed, just to show you some of this. Okay. So here we got a Huffington Post article that came out on the 17th. I'm going to show you some of the comments that are being posted by healthcare workers. Okay, here's the story. It says, COVID isn't the only issue we're fighting. Exhaustion among the medical professionals is more severe than ever. And move on down. As the COVID pandemic continues to rage on, burnout among healthcare workers is more severe than ever. Here's what they want you to know. Okay. Here's Susan Smith, a pediatric ER physician. Wasn't expecting to retire anytime soon, but then COVID hit. Even though this will hurt me financially, I'm done. The antivaxxers, the Trumpers, the conspiracy theorists have all just worn me down. So here you have a physician who's just done. She's done trying to convince people. She's done fighting people, trying to protect their children from, what potentially is coming. I hear people say, well, it's not that bad. I had it or somebody else had it. There's always some anecdotal story about how precautions don't need to be taken. But, I'm telling you, don't fall into that, because I'm telling you, people having lung transplants, people having issues death is not the only thing that can happen to you. There are a number of things that can happen to you. I'm going to, do a show on autopsies that a physician, an ICU physician, performed. And he's going to tell you guys, what he's seeing, the damage that's being wrought on these people systemically is significant. And if you can protect yourself from that, why would you not? And I've heard everything from, historical, precedent for, blacks being manipulated and used as guinea pigs and all of that. But that has nothing to do with this. Nothing to do with this. Everyone is taking this vaccine. So it's not just, they're just not keying on black people. I've heard everything from the 5G, crystals that are in it and, all kinds of ludicrous statements. You can show them what's in it. They still don't believe you. You can show them, why they're going to need booster shots. They don't want to hear it. They want more information, but when you give them more information and then the information changes, they go, oh, well, the information was different last week than it was this week. But you have to realize that we're gathering data on a daily basis, and that data is going to change. So as that data comes in, maybe the situation has been a little crazy because I think they have overestimated the ability of the public to be able to digest and sort through this information. This information, they put it out in layman's terms, but then where there are holes in the information or where there are questions about the information, people are just in a frenzy, making things up. You tell them, one fact and they'll move the goalpost and say, well, what if a turtle crossed the street when this happens? I mean, that has nothing to do with it. It's insignificant. What if, or, this could happen, that could happen. There's no, no factual basis to anything that these possibilities that these people bring up. So then it's like, how do I convince a person who is can't be convinced? So we're getting to the point to where we're sick of it, So I'll move on to the next comment. Every day I work is a nightmare of people dying and treating people close to death. There aren't many happy endings anymore, said Sam, a respiratory therapist who is among those who've weighed leaving the field. Now, I'm going to tell you why it's difficult for respiratory therapists. They're the ones who have to maintain those vents, maintain those pressures on those vents to make sure that you are, the vent is basically making you, it's breathing for you. It's inhaling and exhaling for you because you can't do it. You get to the point to where you're trying so hard to breathe the way you can't breathe, and they put you on that machine so that you don't hit a point of exhaustion to where you can't breathe anymore. So that machine maintains your CO2 levels, your O2 levels, and it keeps you alive. But before any of that takes place, you have to be intubated. Tube has to be inserted into your lungs. And the airway that's going to be maintained, for this machine to do its work. So in the process of doing all of that, he's exposed to the virus in its purest form. If he's not protected enough, he has a greater risk than anybody. Well, not anybody, because we're all at risk, because we're all trained to intubate, and we all may have to get in there. We may have to, keep it, open that airway and insert that tube to basically get you intubated. So anyone from a nurse to the doctor standing over you, to that respiratory therapist, we're all, exposed at that level to potentially being infected with something that could kill us. Now, you may do that with, 5 patients a day. In this situation, maybe more. It's I'm not sure how many it's going to be. I'm sure it's going to be a variable amount, but I know that it's more than we're used to dealing with. So that's the issue. The stress of running out of equipment, and that respiratory therapist, maybe 2-3 of them, they'll all be running from patient to patient that are on those vents and having to maintain those patients, having to document on those patients. It is a stressful situation for them and for us too. So I'm gonna go down to a nurse here who's talking about her experience. Nurse Carly Russell is sticking it out. In spite of feeling worn out, you don't realize how upsetting it can be to hear people say it's not that bad, or hearing someone say, this is the job you signed up for. So you see people are completely, just without compassion about what you have to go through and what that patient has to go through. They don't give a shit. Oops, I'm sorry. I didn't mean to curse. But yeah, that's how we feel. These people don't care, and it's hard to care about people who don't care. You can see how these people are garbing up. You know, what we have to wear, face shield, the mask, they're double masking right there. You know, wearing gloves, wearing gowns, you know, and getting ready to go into an enclosed area, because what you see there are enclosed areas in an ICU where they have to go into these areas and treat these patients and come out of those areas, disrobe, you know, and do it all over again. However many that you got to take care of. Okay, here's another story here. Melissa Rusiano is a social worker who helps many healthcare workers. The story that most medical professionals often tell themselves is that it's only one more patient, or I can help one more person, or one more shift. And I can tell you that's true. That's true. You know, a lot of people sit up and they try to, you know, get through their, you know, a 40-hour work week, you know, or 80-hour pay periods. Well, I can tell you that's nothing. That's nothing. And that's nothing compared to, look, I've done that. I've done way more than that in the last 2 years. You know, I may get one day off a month working with this stuff, and working when, you know, we have the shortages that everybody's talking about. You know, they're offering us free, you know, mental health care visits in order to, you know, combat the stress of seeing all of this. I mean, can you imagine? I mean, most people who have to go to a funeral or seeing, you know, people around them die as they, you know, go up in age or whatnot, it's a stressful situation for them. Now, imagine someone in a situation like that where they're seeing, you know, dozens of people die. You know, they're seeing, you know, 4 or 5 a day, or, you know, or more. I mean, that's a big stressor on you, because I mean, think about you denying yourself, you know, the room to think about your own mortality while you're watching people expire constantly. While you're in that, you see what they're wearing? That's what we have to wear. Those white suits, you know, you're double gloved, you know, you're masked up, goggles, you know, hoods, you know, and that's not, I mean, I can't tell you how hot that is. You know, missing meals, you know, just constantly working. You know, sometimes you can't leave work because you don't have relief. So you have to work another shift until your time cuts off to where, you know, you hit your 16 hours and you can't keep going. So then you have to either sleep there until your next shift, or you go home and then you come back in a short amount of time and start it all over again, you know? And some people are just not equipped to handle that type of stress. Now, you know, having a military background, I know what it's like to work like that. You know, I know what it's like to work until you can't work anymore, and then you sleep right where you drop, you know? So, some of these people out here are just not prepared for this. And what we're moving into is, you know, essentially like a combat situation where you are out here and you're treating and triaging people who are coming in various different situations and levels of critical care situations. So we'll move on to a few more here. When Rusiano's clients ask her, how am I supposed to take care of myself when I have no time? She reminds them of the importance of establishing boundaries. She also recommends meditation and solution-focused mindfulness and talking to a therapist or coach. So how do you do that when you're constantly working? You know what I mean? Unless those coaches are going to come down and, you know, meet you in you know, in an area outside of that, you know, that area where you're treating all of these infectious patients. So they're gonna render therapy on the go while you're down for a few minutes to go to the next place to recommend things that you don't have time to do. And I know how this sounds. It sounds kind of, I don't know how to describe it really. I'm gonna present it and let you decide how it sounds. So here we go to another one talking about the impact of how the pandemic has changed your view on your career, life, and even people in general. Does not change the events that are going on around us, but it helps you to realize that you are not alone, Luciano said. And I'll leave it there. But there's a story here. I think I'll put it down there from the Huffington Post that discusses this in a little bit more detail. I think it's a worthwhile read if you want to understand the effects that this is having on healthcare workers. If you know somebody that's in the field that may be having a difficult time, now may be a time to kind of give them a call and tell them that you're thinking about them. Move on to the next part here. And this was in August. As of August 23rd, the national forecast predicts 7,800 to 27,000 new COVID-19 hospitalizations will likely be reported on September 20th. And there you have, the graphs again showing the steady increase of patients who need critical care. And it is growing faster than we can deal with it. Here's another one. As of August 23rd, the national forecast predicts 55,100 to 17,700 new COVID-19 deaths will likely be reported during the week ending in September 18th. That will bring the projected total members of the U.S. deaths to 651,000 to 680,000 more. That's a big number for people to say that this is an insignificant situation and doesn't merit the general public's attention. And the measures that are being taken for the entire population of the United States to try to protect themselves against something that's killed 651,000 to 680,000 people. I don't think people really realize how big that number is, but maybe you ought to Google and see, how many people that really is. And that number's growing. Florida's contributing a huge chunk to that number. So is Texas. Most of the states who are anti-vaxxer states and Republican-led states are suffering the most. Black people are suffering immensely during this situation. Poor people are suffering from this situation because poor people are believing the narrative that's being placed out there. So here's another story. This will be another situation that kind of gives you another perspective on how bad this is. Memorial Hermann closes 3 standalone ERs in Greater Houston. Okay, COVID-19 surge prompts resource management for hospital systems. Medical staff from hospital systems across Greater Houston, including the Cathy area, are saying they are exhausted as yet another wave of COVID-19 swamps emergency rooms and intensive care units across the region. So Memorial Hermann announced Monday that due to the continued COVID-19 surge and the strain in the hospital system's operations, it was closing 3 of the 24-hour emergency rooms at 5 p.m. Monday evening until further notice. The 3 ERs affected at the Memorial Hermann Covenant Care Centers in Kingwood Springs and Siena, patients who are currently receiving care inside of these emergency rooms will be safely discharged and transferred to another Memorial Hermann facility. Members of our community who require emergent care should proceed to another facility or emergency center for assistance. Okay. It says the statement from the Memorial Hermann Media Relations team said in a statement to ABC News affiliate, Memorial Hermann said, closing these locations allows us to reassign staff to other Memorial Hermann locations where their help is critically needed. It also eliminates the need to transfer these patients to the main hospitals for admissions, if necessary. As the coronavirus continues to prompt increasing hospitalizations, hospitals throughout the greater Houston area, including those in the Caddy area, have stated that staff are exhausted and capacity at hospitals is short or non-existent. More than 350 patients have been admitted to hospitals within the Texas Medical Center for all but 2 days since August the 7th, according to TMC data as of Monday evening. Okay, so that's a little bit of old story, but I mean, as you can imagine, 3 standalone emergency rooms shut down, and how that's going to affect the community, and how that's going to redirect people to those main hospitals, something that was not, is going to be a problem. Let me just say that it's going to be a problem. You're going to have huge surges of people. It used to be the hospital systems used to have, levels. You'd have these rural hospitals, you'd have clinics, and then you'd have the main hospitals. So these rural hospitals would take, certain numbers of patients they could handle. If they needed care that they couldn't render, they would, send you to the main hospital. But those numbers were always numbers that could be easily absorbed by that medical system. But we've surpassed that a long time ago. And a lot of the rural hospitals have shut down, because everything's being pulled into these conglomerates, these huge hospitals within the metro areas. We don't have that buffer system anymore. And there's been a nursing shortage for a long time. There's been a physician shortage for a long time. And it's even worse right now. And a lot of people are saying that, I'm not going to do it, and this is going to affect people, so if you're not listening, please listen, please look up the information from reputable sources, read the information, take it in, do not engage in what-if-isms and what-about-isms and all these, these mythical, paths that everybody want to go down. Look at the data for what it is and make a decision based off the data that you have, not off of the data that you want to fabricate out of the thin air. Okay. I appreciate you guys coming out, taking the time to listen to me and to try to, we work this problem out together. I want to appreciate all my subs. I want to appreciate the ladies that have been watching, the guys that have been watching also. I hadn't been, thanking, my female audience, but They're out there. I got a little hit saying, "What about us?" So I appreciate you guys too. Let's all do our part in trying to help each other to get through this so that we don't have to do a shutdown anymore, so that our economy can get back to where it is, so that we can get back to some semblance of normality. And I guess that's all I got, guys. I really appreciate everything. Thank you guys for the donations. I appreciate it. And thank you guys a lot.
You are listening to Abuki Cabal, the analytical savage.
I feel like a motherless child, a long way from home.